Thank you for joining this second Mid-4 online meeting of the History of Pathology Society, entitled Milestones and Pioneers in Pathology. I am Raffaella Santi, currently the president of the History of Pathology Society and hematopathologist at the University of Florence, Italy. For those who are reaching us for the first time, the History of Pathology Society is a scientific society dedicated to the study of the pathological sciences and to people and events who widen the sphere of medical knowledge. Conceived in 1994 by Henry Azar and Christian Nazelov, then formally founded in 1996, the History of Pathology Society now gathers numerous members from different geographic areas with different expertise, all sharing a keen interest in the historical aspects of our discipline. In 1997, the United States and Canadian Academy of Pathology, USCAP, designated our society as a companion society, allotting a Sunday afternoon slot for the society meetings during the USCAP annual conference. Next year, the companion meeting will take place in Boston during the USCAP annual conference and will be the occasion to confer the Azar Award to honor the foundation of our society and to give a prize to the best contribution on history of pathology submitted to USCAP. Now it is time to introduce the first speaker of our meeting, who is Professor Marco Pizzi, Associate Professor at the University of Padua, Italy. Dr. Pizzi's research activities are focused on the clinical, pathological, and biological features of adult and pediatric hematological tumors. He is member of renowned international scientific societies for hematopathology, and is involved in nationwide research projects on lymphoid tumors. But his interests also cover the history of medicine, and today the topic of his talk is Giovanni Ghedini and the origin of bone marrow biopsy. For the audience, please mute your microphones during the lecture. Please, Marco.
So thank you, Raffaella, and good afternoon to all you who attend this meeting, and good evening for European ones, because here it's still evening. So I hope you can see my screen. Let's share it and let me know whether you can see it. I think we're okay, isn't it?
Yes, we can see it.
Great. So thank you very much for this introduction, actually, and thank you for this invitation. As Raffaella said, I am an hematopathologist. My main duties are just diagnosing hematological disorders of both adults and pediatric patients, but actually, I strongly believe that understanding the history of our discipline helps us also to better do our job every day. And I'm really happy and almost, I would say, honored to share what we studied a few years ago about this almost unknown doctor here in Italy, Giovanni Ghedini, who actually, at least for our, to the best of our knowledge, was the very first one to perform bone marrow studies for clinical purposes. So this is a kind of international project which pursued with my mentors when I was in the US, because I also trained in the US for a few months in New York with Professor Attilio Orazzi. And actually, we shared this interest in this area of medicine a few years ago. He just wrote me an email saying that, did you know that Ghedini was the very first to perform bone marrow biopsies in the history of medicine? And that he was from your city, Padua. So actually, I didn't know. So this was just the beginning of a very interesting study for us, at least, to understand who was Ghedini and what he did. Well, as we all know, bone marrow biopsy is just a kind of end product of a very long path to bone marrow biopsies. Actually, we all know that up to the Neolithic age, we had proofs of skull drilling and bone drilling for medical purposes, maybe magic purposes, and this was still the case up to the Renaissance age, as we can see here in a Bosch picture, where we can see that drilling of bones were actually applied very early in the history of medicine, but for different purposes, maybe some attempt of cure, even psychiatric disorders. So this is nothing to share with bone marrow biopsy as we do it today. Actually, one of the very first evidence that bone marrow biopsy, or at least bone marrow studies, were applied for clinical purposes comes from another relevant famous physicians in Italy, Giuseppe Pianese, working in Naples in the second half of the 19th century. Actually, Pianese published a couple of cases, autopsy cases, in which he could demonstrate that leishmaniasis was actually infectious disorders of the bone marrow, because he could detect leishmania in the bone marrow of two children that of this disease. But again, to me, this was not intended for clinical purposes. It was just a kind of scientific interest to document that disease still infected the bone marrow. And actually, it's meaningful that it was applied just in the bone marrow of that patient. So it was not intended for routine clinical practice, but was just a kind of clinical research purpose to understand what was going on in the patient dying of leishmaniasis. Everything changed with this man, Giovanni Ghedini. You can find here his picture. And Ghedini was born in the second half of the 19th century from a wealthy family close to my city here in Padua. And he graduated at the University of Padua, becoming a medical officer in the First World War. He served as a medical officer close to here, close to the Italian front. And then after the war, he was hired as a physician in Genoa at the medical clinic, which at that time was held by Professor Maragliano, who was a very famous physician in Italy at that time. And this probably changed his approach to diseases and hematological diseases, as we will see in a few moments. Because in 1908, we have proof that Ghedini decided to perform bone marrow study in living patients to better understand the causes and patterns of anemias, which were difficult to understand by clinical means only. And the publications has a very relevant title, because it clearly states that he performed explorative bone marrow puncture to better understand the pathogenesis and disease of blood disorders. So this was the beginning of our interest on this topic, and basically I decided to focus on three main topics with this about Ghedini, which basically deals with the descriptions of his technique, the understanding of the origins of his idea, because nothing comes from nothing. So I wonder where Ghedini's idea came from. And finally, we decided to track the development of Ghedini's idea throughout the 20th century. So to do this, we applied an historical review and document search thanks to the ancient book section of our medical library here in Padua. And thanks to this, we could collect all the publications that Ghedini made on the specific topic of bone marrow studies. But we also had the chance of consulting private book collections, but also online repositories to understand the origins of Ghedini's idea, and also, of course, the development of his technique later on in the 20th century. So, starting with Ghedini's technique, in his publication, he clearly states that he performed bone marrow biopsy from the upper third of the tibia. And to do this, he applied just drilling of the bone with a steel drill, a scalpel, and a syringe. The reasons why he believed the tibia was the best site to perform this kind of studies is threefold. First, he states that it was safe and easy to perform. The tibia is really superficial, it's not close to large vessels, it is not impressive for patients. And this is the second reason, it was tolerable for them. And finally, according to Neumann studies dating back to the second half of the 19th century, the tibia was a site of allegedly active hematopoiesis. Well, one of the most relevant things that Ghedini understood and applied in his technique was the combination, the combined use of cytology and histology. So he clearly states that he fixed cytological smears even with heat or alcohol, but also he collected tiny fragments of bones to assess the topography of bone marrow cells. And actually, this, according to Dr. Horatis and myself, was one of the most relevant achievements Ghedini had on this, because this was just the beginning of what we still do today with bone marrow studies. There is no way of making a good diagnosis in hematopathology and bone marrow pathology without combining cytology and histology. And this is true for many disorders, both bone marrow metastasis, primary myeloid disorders, lymphoid disorders in the bone marrow. And actually, by applying this combined technique, it could get really relevant improvements in the diagnosis of leukemia in living patients. Today, if we read with Ghedini's publication, we have troubles understanding the diseases he was coping with, because the classification of these disorders was really different from what we have today, and even the nomenclature and terminology was very different from ours. But still, if we read carefully to the cases he describes, we can find disorders that we face today and which can be really well understood even by Ghedini's terminology. For instance, Ghedini refers to medullary metaplasia with megagigantocytes and myelocytes, which is a wonderful way to describe primary myelofibrosis as we intended today. Bone marrow disorders in which we had a lot of hematopoiesis, hypercellular bone marrow, myeloid expansion, megakaryocytic clusters, a lot of fibrosis. And as you can see in this picture, which is taken from primary myelofibrosis, the combination of histology and cytology helps a lot in making a good diagnosis. Well, of course, Ghedini was very well aware that his technique was just the beginning, but it needed improvement. And one of the main troubles he faced with this technique was basically that the bone marrow of the tibia was not always very much representative of the clinical condition of the patients, since he stated that large bones are not always representative of systemic hematological disorders. This was again in 1908. And many physicians, after Ghedini's achievements, realized this. So, since Ghedini's description, there were a lot of attempts to identify different sites for bone marrow studies. And one of the very first ones was in 1922 by Carl Seifert, who was the very first who performed bone marrow cytology from the sternum. But note, this was just cytology, so it was a step back from Ghedini's technique. Seifert technique was improved by a Russian physician, Arinkin, in 1926, but again, it was just cytology. The very first attempt to perform histological studies after Ghedini's ideas dates back to 1932 with Custer in Boston, who performed a kind of large surgical biopsies of the sternal plate to get both tiny fragments of tissue and cells. But again, it was a sternum, and we know that the sternum is really a dangerous place to make biopsies because there are large vessels just close to it. There is the heart, and it was caring for physicians and patients as well. So since 1932, a lot of physicians looked for different sites to perform bone marrow biopsies. And of course, we know today that finally, in 1949, Damashek's group found that the iliac crest was a very safe place and very informative site to perform bone marrow biopsies. So since 1949, this is the preferred site to perform a biopsy, and then if it is not informative, we still recur to sternal biopsies if necessary. So, what about the origin of Ghedini's idea? Well, investigating this specific topic means asking where our approach to microscopy stems from. And actually, the answer, as we all know, comes from a very peculiar moment in the history of medicine and a very peculiar place in the world, which is Prussia in the 19th century. At that time, we know that Prussia invested a lot of money in brand new technology to foster academic research. And at those times, of course, brand new technology was microscopy. So in the 19th century, a lot of academic research laboratories were founded, and microscopy was very much applied to in that part of Europe. And of course, this led to the foundation of the so-called Prussian school, which was actually founded by Johannes Müller in the first half of the 19th century. And Müller is the founder of so-called cellular theory of tumors, by which he understood that each and every tumor consisted of cells, and to understand tumors, probably you should study those cells. But this was just the beginning, because two of his pupils, Matthias Schleiden and Theodor Schwann, invested their efforts to understand the biology of plants, Schleiden, and animals or humans, Schwann. And basically, they founded the so-called cellular theory, by which, as we all know, they believe that all living entities, all living organisms consist of cells. And to understand their physiology, you need to understand their cell physiology. But finally, we have the end of this long process with Rudolf Virchow, who was the founder of cellular pathology. And actually, in the second half of the 19th century, we have proof that his ideas, which were basically on the pathogenesis, on basic research on disorders, were applied in Prussia also for medical diagnosis. But how this moved to Italy? Well, actually, we have two authors which probably influenced Ghedini a lot. One of them is Giulio Bizzozero, who worked in Pavia and Turin, is of course very famous for his theories on and discoveries on platelet function, histiocytes, and the potential renew of cells. But for our story today, Bizzozero is relevant because he published in 1879, he published a book, a handbook of clinical microscopy, which was very much used in Italy, and which helped physicians understand that to perform good diagnosis, you may rely on microscopy, even though those studies were mainly based on urine cytology and some other aspect, not strictly speaking hematopathology or hematology. But then this was a beginning. And this book was really, really widespread in Italy. So it's possible that Ghedini was aware of it. But then another really very relevant protagonist of our story is Luigi Lucatello. Luigi Lucatello was a physician. He worked in Genoa, and in the same years when Ghedini was there, and later on he became dean of my university. He was very famous in Italy as well. Well, Lucatello was the very first who in Genova performed liver and spleen cytological study to better make diagnosis of his patients. He was interested in liver and spleen disorders. So it is well possible that Ghedini, aware of Lucatello's technique, just applied it to another field, which was his field of interest, in hematology. So that we can conclude that the origins of Ghedini idea probably stems from the scientific context, Prussia, school, the advent of microscopy, historical contingencies, is awareness of Lucatello's studies, and also, of course, as always, personal ingenuity. But again, if one asks why he applied these studies to clinical practice, my answer is that probably this stems from some scientific interest that Ghedini had a few years earlier in 1905. In that year, he published a paper in which he basically took a position on a very much debated issue on that time, which was the origins and pathogenesis of leukemia. At those times in Europe, but also in Italy, there are two main theories. The so-called neoplastic theory, by which of course, leukemias were considered neoplastic hematological disorders. This was held by many authors. In Italy, one of the most relevant of them was Guido Banti in Florence. Contrary to this, there is another theory which was strongly advocated by Adolfo Ferrata in Pavia, sustaining that leukemias were just an hyperplastic process of the bone marrow and bone marrow cells. Well, actually, Ghedini took a clear-cut position favoring Banti's theory of the neoplastic nature of leukemias, and to sustain this hypothesis, he clearly states that there are atypical features of tumor cells, atypical features of the connective stroma of invaded tissue, which clearly showed that he was still already applying microscopic studies in 1905 to understand the biology of hematological disorders. So it is well possible that his scientific interests on leukemias, on the microscopic features of hematological disorders, were then applied to clinical practice to foster and improve the diagnosis of difficult cases of anemias. Of course, this was just the beginning. And basically, today, we cannot rely on morphology alone while we sign out cases in our practice, and we have a lot of ancillary techniques. So one of our interests was also to trace the development of these ancillary techniques, and basically, we can divide them in three great categories: cytogenetic studies, phenotypic studies, and molecular studies. And it's fascinating to see that the development of these ancillary techniques is basically parallel to what Ghedini did and his followers did in the 20th century and 21st century. So, for instance, cytogenetics had its foundation in 1902 by Bovery's studies on the chromosomal changes and cancer, and then later on in 1960s and 1973, we had the first evidence that chromosomal imbalances are really relevant for some hematological disorders. Phenotypic studies had their origin much later. We had polyclonal anti-seria in the 60s, but then hybridoma technology in 75. But the very first application of immunohistochemical studies date back, and this is quite surprising for young pathologists today, only in 1983. And finally, we have molecular studies. These are, of course, much more recent. We know that the Sanger sequencing dates back to the 77, but then again, the very first application of molecular studies to hematopathology dates back to 1983 with just Sanger's Southern blot for molecular testing. Of course, in 1985, the advent of PCR technology changed everything, and we have now NGS studies, which dates back only to 20 years ago. It's of interest that the very first neoplasm, which were studied by NGS, was a leukemia. So again, hematopathology probably is an easy field to apply new technology, as we can see in all this presentation. So just to conclude, I think that Ghedini's ideas stemmed from the histological and scientific context of his period, and that in his view, one of the most relevant things was the integration of cytology and histology to get good diagnosis for blood disorders. And again, this is just history, but as everything in history, Ghedini's approach, this historical approach, teaches us that the mainstay to make a good diagnosis and a good classification of disorders is just the integration of different approaches and, a critical and very interested way of applying these new technologies to the study of disorders. So thank you very much. I'd be happy to answer any of your questions.
Thank you very much. That was excellent. I really enjoyed very much. Two questions.
Thank you.
If I may. One of your first slides, you indicated that Ghedini used an electrical tool for making biopsy. How was that design?
Actually, I was surprised too, because I didn't think that electrical drills were still available in the very beginning of the. Actually, he did not describe very well this, because to him it was clear cut that electric drills were available at that time. I'm not sure whether there was some plugs to use or just batteries. It didn't say.
And secondly, the cytology evaluation of these specimens, they use the right hip sustaining or what kind of stain they use? Or any other stain?
Yeah, he used GIMSA actually, but he also at those time there is no. Ehrlich technology, the techniques were known, and he applied those stains. So there are many stains he refers to that which are not in use today. He refers to using GIMSA, but others that I couldn't understand exactly what he referred to.
Okay, thank you very much. Thank you.
Thank you.
Thank you very much, Marco, for this fascinating journey in the bone marrow. We have another question from the audience in the chat. I am going to read it. Was Ghedini involved in discovering any other morphologic diagnostic findings on microscopy of our marrow? Did he study an infection or so?
Well, I don't think he described new entities. Since, for instance, the medullary metaplasia I referred to, in his paper, it looks like a disease that was already known and is just recognized. I don't think he described this as a new entity. But to answer the second question, infectious disorders, actually Ghedini was really much interested in many different fields of medicine. One of them, of course, hematology, but there are a number of publications dealing with infectious disorders as well, and endocrine disorders and endocrinopathology. So he studied a number of entities in these specific papers, the ones in which he deals with bone marrow studies. Actually, he did not refer to infectious disorders.
Thank you.
Well, thank you.
Are there any other questions or comments for Dr. Pizzi? If not, I give the floor to Dr. Pino Viedo, who will introduce the next speaker. Please, Sergio. Thank you.
Hello, everybody. Thank you. And I have to say also, as a hematopathologist, thank you, Dr. Pizzi. That was fantastic. And if you haven't published that, you should write a paper and publish some of that information you presented.
Well, actually, if you're interested, it was published in British Journal of Hematology a couple of years ago. So I can share if you want.
I'll definitely look for it. Thank you very much. And